Hello and welcome to the latest webinar from the British Lung Foundation. Today I'm delighted to introduce Dr Nick Hopkinson, who'll be running a session all about COPD. And don't worry if you miss anything today either, because you'll receive an email over the next day or so containing a replay link. Also, for those of you who aren't aware, we've recently launched our Christmas appeal, and this year the focus is on keeping you and your loved ones safe and well. However, if you would like to support our work, please do consider making a small donation after today's webinar. Now, without further ado, let me hand you over to Dr. Nick for today's webinar.
Hi, my name is Nick Hopkinson. I'm a reader in respiratory medicine here at Imperial College and also medical director of the British Lung Foundation. And I'd like to talk to you today for about 10 or 15 minutes about COPD and breathlessness and how best to look after yourself if you've got the condition. So first thing is, well, what is COPD? It stands for chronic obstructive pulmonary disease. It's a pulmonary disease because it's a lung condition. It's chronic, which means that it's something that's there for the long term. And it's obstructive because the main physiological process is airflow obstruction. So people have difficulty moving air in and out of their lungs, and that causes breathlessness. COPD is made up of two sort of main pathological processes, chronic bronchitis and emphysema. Chronic bronchitis is inflammation in the airways, and emphysema is where the lung tissue itself is damaged. So the tiny air sacs in the lung where oxygen is taken up and carbon dioxide is removed. Those tiny air sacs break down and form sort of bigger and bigger holes, and the lung becomes sort of baggy and saggy and traps air rather than being sort of healthy and springy. So how does airflow obstruction happen? When someone is just sitting still, breathing quietly, the lungs are designed, if you like, in order to allow people to breathe in and out with the minimum amount of effort. So with a tiny effort that you don't even notice, you can breathe comfortably at rest, moving sort of maybe half a litre of air in and out each time you breathe. When our bodies need more oxygen, so if we're walking or running, so our muscles are using more oxygen and they're producing, and as they use the oxygen, they produce carbon dioxide as a waste product. So you have to breathe more to get rid of the carbon dioxide and get more oxygen in. So in order to breathe more, there are two things you can do. You can take bigger breaths, so you breathe further in and further out, and of course you breathe more rapidly as well. And that's what happens normally. Now, the problem for people with COPD, particularly as it gets more severe, is that airways, the small airways in the lung are destroyed, are damaged, and the larger airways become sort of swollen and narrowed, so that it's just harder to move air in and out. So somebody wants to breathe more quickly, but actually they can't move the air out, and that's called expiratory flow limitation. They can't breathe that out air as fast as they'd like to be able to. So what happens? So the person is trying to breathe quickly. They can breathe in all right, but then when they try to breathe out, they can't get the air out. So what happens is that breaths sort of stack up. You can get the air in, but you can't get it out, and you get what's called hyperinflation. So air is trapped in the lungs, and at the end, people can be breathing all the way up here, and it's hard work to breathe at the top of your lungs. COPD is a condition anyone can imagine having just by taking a big breath in and then a small breath out, and then just carry on breathing at the top of your lungs. And the lungs aren't designed to work like that. It's harder work to move your chest wall up there. It's harder work to actually move the lungs. The lungs become stiffer at those sort of higher, when they're nearly full. And there's a sort of ceiling. You can only expand your chest so far. So you get a kind of limitation to breathing. And sort of curiously, even though the problem is breathing out, what people often experience is a difficulty breathing in because they're all the way up here and it's hard to get the breath in. So what can be done about that? So there are a few things. So the one that people think about the most, know the most about, of course, is using medicines, is inhalers. So there are various inhalers, inhaled medications called bronchodilators that people can use that open up the airways that will that enable more air to get in and out. And in people with COPD, because a lot of the damage to the lung is irreversible, you can't get back to normal. But the bronchodilator medications, by opening up the airways, do improve things. So probably most people who've got a diagnosis of COPD will be on inhaled medications. And those inhalers, as well as opening up the airways, can also reduce the risk of inflammation, of infection in the airways too. So they reduce the risk of people having what are called acute exacerbations of COPD, where they become sort of acutely or rapidly more breathless than usual, often producing sputum. And if they produce sputum normally, it changes colour to be sort of muckier, kind of green or brown colour. So that's in inhalers. Now, the other thing that happens to a lot of people with COPD is because it's a condition that makes you breathless, and because breathlessness is unpleasant, what people naturally do is avoid things that make them breathless. So we'll often find that they stop doing activities, and quite often when I see someone in clinic who says to me, "I've had COPD for 6 months or for a year," when you go back through the history, you'll find that they've been breathless and a little bit breathless and have been sort of stopping things for 5-10 years past without actually getting a diagnosis, without realizing that what was happening was not just a normal part of aging, it was actually a symptom of a lung disease. So the good thing about this, if you like, is it's to some extent reversible. So if someone is breathless, they do less, they get less fit, and they get breathless more easily. It's possible with training, with physical activity and exercise to actually improve that. And one approach to this is what's called pulmonary rehabilitation, where people take part in a regular exercise program of which is sort of assessed and supervised by physiotherapists and other healthcare professionals to encourage people to sort of push against their breathlessness. Breathlessness is unpleasant, but it's not harmful to make yourself out of breath. And one of the things that happens is by pushing yourself and making yourself breathless, you learn techniques to control it, and then that helps you to get your breathing back into a comfortable place. But you also realize that nothing bad happens. You get very breathless, and then you bring it back under control, and it makes it sort of less frightening. So I've shown you already that if you breathe rapidly, you stack up breaths and end up here. So one of the key things to learn about controlling breathing is to slow that exhalation out, so you can actually get the air out before you start breathing in again. So there are various techniques that work better for different people. Some people find that leaning forward to sort of help support their breathing muscles is useful. Some people find what's called pursed lip breathing. So breathing out through your pursed lips is helpful because that, again, slows breathing out and means that you can get down to a more comfortable level. And partly and understandably, that rapid breathing is just panic. And once people recognise that they're panicking about something that they can actually get back under control, the problem becomes less of an issue. So, in terms of breathlessness, just to recap, there are inhalers, and obviously, if you're using inhaler, it's really important to make sure you're using it properly. Hopefully, whoever gives you the inhaler will have shown you how to use it. But there are very good inhaler technique videos on the British Lung Foundation website you can look at just to check your technique and make sure that you're getting everything, or all the key steps in getting the medication down into your lungs properly. So there's inhalers, there's pulmonary rehabilitation, and there are sort of techniques to help control your breathing. Another approach that some people find very helpful is singing classes, and there are Singing for Lung Health groups that have sprung up all over the country now that are worth trying out. And getting in touch with your local British Lung Foundation Breathe Easy group is quite a good way of finding out what's going on in your local area. The other trick that some people find helpful is actually using a little battery-powered handheld fan. The sensation of cold air on the face actually, it can relieve breathlessness. So And there's actually quite good evidence that these little fans can be quite a good way to relieve breathlessness. So one of the other things that is very important in COPD is what's called self-management. Now, this is something that everyone with a long-term medical condition needs to be able to do. They need to understand what their condition is about. They need to be able to explain it to other people. They need to know to look what signs they should be looking out for, what symptoms they should be looking out for, and when they need to call for help, when they can look after themselves, and in COPD particularly when they should start to take medicine if they're having an acute attack. So again, there are very good self-management plans available through the British Lung Foundation, and there's also a thing called the COPD Patient Passport. So this sets out a list of things that any person who's got the condition, anyone who's got COPD, should be able to answer yes to, basically. So if you've got COPD and it's been explained to you properly and you're getting the appropriate management, then all of these things should be in place. So it's a checklist, if you like. And the great thing about having it as a list is it's a reminder to yourself, but it's also something that if you're talking to your GP or to a respiratory nurse or a hospital consultant or a physiotherapist, anyone involved in your care, you can just go through it and see, well, is there anything missing? You can. It helps to ensure that kind of gaps in care, are filled in, that people get what they actually need. So one of the really key elements of self-management is around exacerbations. It's recognizing when day-to-day symptoms. Someone might have a kind of normal cough and produce some sputum every day, but when that changes and they become more breathless and their sputum has changed to an extent that they are developing what's called an acute exacerbation. It's usually a form of chest infection. They're usually triggered by viral infections or bacterial infections. A lot of people with COPD will have what's called a rescue pack at home. So that's a short course of antibiotics and steroid tablets to take at the beginning of the exacerbation once it's sort of established, in order to prevent things getting worse and to help it to improve more quickly. So again, that's something to talk to your respiratory nurse or GP about. It's not a substitute for engaging with healthcare, but if you've got the antibiotics and steroids at home and you know that you're getting exacerbation, you can start on treatment quickly and then let your healthcare professionals know that that's what you've done. So one last thing to sort of think about it. So NICE, the National Institute of Clinical Excellence, has come up with what it calls the 5 fundamentals of COPD care. So as well as medications, these 5 fundamentals are things that need to be considered for anyone with the condition. These are smoking. Stopping smoking is the most effective treatment for COPD in people who carry on smoking. It stops the disease progressing. It reduces inflammation in the lungs, makes people cough less, have fewer exacerbations. Pulmonary rehabilitation is really important. So the exercise program I talked about earlier. Vaccinations are really important. So getting a flu vaccination every year and pneumonia vaccination once reduces the risk of adverse events. Having a self-management plan, which I've talked about. And the last one is, for most people with COPD, because it's a condition that people tend to get as they get older, and because it's associated with smoking often and with occupations where people have been exposed to a lot of dust or fumes or chemicals, people with COPD often have other long-term health problems. So one of the key issues is to make sure that all of those are kind of identified and looked after properly. So particularly that a lot of people with COPD may also have heart problems, so it's important to watch out for those. And a lot of people with heart problems actually have COPD as well, and it's important to think about that if someone has got a heart problem and is breathless. So the 5 fundamentals, the COPD patient passport, and having a look at the British Lung Foundation website, which has got really good videos about inhaler technique and about exercise, are all useful things that you can do. Thank you.
Thank you so much, Dr. Nick, for today's webinar. And to all of you watching at home today, I really hope that you found today's session useful. Please do remember that if you missed anything today, you'll receive an email over the next day or so containing your replay link. Also, don't forget, we've recently launched our Christmas appeal, so if you are able to, please do consider making a small donation after today's session. On behalf of myself and everyone here at the British Lung Foundation, thank you for joining us. Please do stay safe, and we look forward to seeing you at another webinar very soon.